Hey there, guys. Just a little quick tutorial walkthrough to introduce you to your CPT manuals. I have included this PowerPoint inside of your week one resources. And really, this is just a quick breakdown of the basics of CPT, starting with what it is. So, I'm going to base this video, my practice exercises off of radiology because that is the first um, section that you'll be introduced to, or range of codes that you'll be introduced to. So that's what this little presentation will be specific to. But general information first. So what is CPT? So CPT is a set of codes that were developed by the American Medical Association. These, the manual itself is updated annually, and every year there'll be new codes added, some descriptions may change, codes may be deleted. And what these codes do is they translate physician procedure terminology. So an example of that would be a wrist X-ray, right? That is physician procedural terminology, verbiage, and we turn that into a 5-digit billable code. And that's how the insurance companies receive our claims, is we turn that language, that English language, into a numeric sequence of digits to represent a service, to represent a procedure. And these codes reflect the services that the patients have received. So this can be anything from a consultation, this can be an emergency room visit, this can be a vaccine, this can be physical therapy. So the list goes on and on. As again, these are all what this book is a book of services, a book of procedures, a book of diagnostic and screening exams, right? It's all different ways that we can treat and manage a patient's health, okay, or health conditions. All right, so I'm going to open up my table of contents here so we can kind of scroll right along and follow along. Your CPT book is broke down into 6 main sections. So the first section is going to be evaluation and management services, okay? And then the next section after evaluation and management is going to be surgery. Surgery is your biggest section, or excuse me, not surgery next. It's going to be anesthesia, then surgery. So anesthesia comes next, then surgery, and surgery is going to be your biggest section. Surgery is then broke down by body systems: integumentary, musculoskeletal, respiratory, cardiovascular, etc. And each one of these different body systems has a range of codes that's specific to that particular body system, and then particular organs and regions within that body system, like heart and pericardium, pacemakers, etc. All right, just to name one from cardiovascular. And then once you get past your surgery section, then the next section is going to be actually radiology. That's what we call the 70,000 codes. And then you'll have pathology, which is your 80,000 series of codes. They all start with eights. And then the next section after that will be the second biggest section, which is medicine. And medicine is broke down into more diagnostic and study, sleep services, more therapeutic type things, non-invasive, okay? All right, so within each section, and so let's just open up digestive, for example. Within each section, then it'll be broken down further into subsections and subcategories and headings. So section, main section, digestive system, subsection, lips, and then anything bold and blue or all the different types of services or subcategories. These are subcategories of services that can be performed on that specific anatomical area or site of the digestive system. And then we get into the vestibule of the mouth, okay? And then you're going to have subcategories of different services that can be performed on the vestibule of the mouth, tongue and floor of the mouth, right? And so again, always pay attention to what the body area, right? Because incisions, for example, incisions and drainages can happen anywhere that there's an abscess on the body. So always making sure that you're also in the right anatomic site and body system. All right. So sections of CPT, so all sections with the exception of evaluation and management are in numerical order. So evaluation and management is not in the same sequence. They start with nines, 99211, for example. And the reason that evaluation and management comes first is because it is the most frequently used healthcare setting. Now, after evaluation and management, you'll start to see a sequence, a pattern start to emerge, right? So anesthesia starts with zeros. And then after anesthesia, you get into integumentary. So integumentary starts with the number 1. Musculoskeletal codes, they start with the number 2. Okay, so you'll start to see this pattern emerge of this sequence of codes. And again, those ranges of codes represent the different body systems and the procedures that are associated to that. Most subsections are going to be arranged by anatomic site and then the type of procedures to be performed on that anatomic site. Let me go back to integumentary because this is a good one. I highlighted way too much. So for example, you've got different types of procedures. So you've got like shaving procedures of lesions. You've got removals of skin tags. So this is all going to be surface skin. Then you get different types of biopsies. So these are all different types of services that can be performed on the skin and subcutaneous and accessory structures. Please, if you are looking at your book and thinking, why are all of my words highlighted yellow? Know that that was an accident. I never intended to have this whole page in yellow, and I can't figure out how to get it off. All right, so, but you can highlight certain sections, right, to make them stand out as well. So again, anything in blue, right? Those are going to be the different types of procedures that can be performed on that anatomic site. And then you're going to have different descriptors. And typically the subsections are going to run from head to toe or trunk moving outward, or it's going to be from the inside out. So for example, inside out is going to be starting with the skin, right? That's our external organ. And then going all the way into, to the, respiratory, lungs, cardiovascular, digestive, different systems. All right, so for example, let's check out a subsection, anatomic site, procedure, descriptor, and location so we can get that rhythm. So I'm going to come down here to our radiology section, okay? And I'm going to start highlighting so this will stand out to you. Main section, radiology, right up there at the top. Subsection, diagnostic radiology, okay? Anatomic site, head and neck. This is this is your typical flow of each main section. Then the types of procedures, myelographies, exam of the mastoids, exam of the optic foraminas, etc. Let's go down to, let's see here. Where's our CTs at? There we go. So for example, 70450, it's still in the same anatomic site, head and neck, right? But it's a different service. Now we're talking computed tomography, head or brain. So, and then that would be the location of the, so that would be your descriptor, right? Computed tomography, and then location of repair. Now here's another anatomic site. Now we're getting to the spine and pelvis. So spine and pelvis services, right, would start, if we're talking about diagnostic radiology, it would start with code 72020. That's where spine and pelvis services start, right? And then all of these codes would be specific to different types of CT scans, X-rays, MRAs, etc., of that body system, or excuse me, that anatomic site. And here we are now. That would be the last code for the spine. And what was it? Spine and pelvis. And then it would get into upper extremities, lower extremities, etc. Okay. So that is the flow. All right. Now I've talked about this in other videos, but if this is the first video you've watched of mine, let's talk about this semicolon. It is a big deal. So the semicolon, this little colon right here, is really important in helping us determining the correct code. So the semicolon separates the main term, or what we call the common portion of a code. I like to just say parent-child relationship. I think it kind of just makes a little more sense to me that way, to connect it. But always, anytime that you see a code that includes a semicolon, I want you to always say to yourself, stop, stop. As soon as you see the semicolon, that's the point where the parent code, the base procedure, ends. And anything that comes after that procedure, or excuse me, after that semicolon, would be specific, would be a specific approach to that base service, right? So consider these child codes. So, for example, I landed on the CT scan one, 70450. Make that bigger. 70450, computed tomography, head or brain. Stop. There's your semicolon. And then, oh, that's not what I wanted to do. Okay, now I have a red code. All right, there's a little semicolon there. So anything before that semicolon is the base procedure, computed tomography, head or brain. Anything after that is a unique approach or unique type of that procedure. So without contrast material. So 70450, the 0 in this code represents without contrast material. Now look right underneath of that. There's a code 70460, and it just says with contrast material. Okay, so that means when you don't have a full description, it means that it's connected to the code above it. So this is a parent-child relationship. So how would you read 70460? You would read computed tomography, head or brain, stop. That's the parent, that's the base procedure right there. And then your unique type of that procedure was without contrast material. So your final answer would be 70460. Okay, now I'm going to use the example that's on the slide now. So 71045. Let me scroll down here. Here we go. So using the example on the slide, radiologic examination chest, semicolon. So that is where the base procedure ends, right there. That is the base procedure. Anything after that semicolon is a type, a unique variation of that base procedure. So the 5 in 71045 represents a single view. Now notice right underneath of it, you've got these three codes that that don't have much description at all. It just says 4 or more views, 3 views. That's because these are all children of this descriptor, radiologic examination of the chest. So if they did 2 views, you would select the code that represents 2 views of this radiologic examination of the chest. If they did 4 or more views, it's the same service, right? But because there was more of it, you're going to code it at a 71048. So again, making sure you're always reading all of the indented codes, right? That come directly below a main code. So anytime you see that semicolon, it's kind of like a clue that there may be more than one type of this service. So quantity may be part of that. So paying attention to those little details. All right, let's get into the index. So if you haven't already watched my video, I did put out a video on how to tab your digital books. So first, let me just show you where the index is. So again, I'm in your table of contents over here. And when you get to your index, there's a whole list of instructions on how to use your index. So same information. Indexes are arranged by main terms, procedure or service, organ, or other anatomic site. You could also find procedures by the condition. So say like hernia or abscess, for example. And also by synonyms, eponyms, and abbreviations. I always suggest starting with identifying the service first and try to look it up that way. Now, to make your journey through your index a lot quicker, what I suggest is going through and creating a digital tabbing. Digitally tab your index. If not, here's what's going to happen. You're going to be in your index and you're going to be like, okay, A, and then you got to keep scrolling. And then you're like, okay, I got to get to the B's. Where are the B's at? Right? So if you just tab it with notes, I opened my little symbol here. I went to annotations. I clicked on the little highlight note, and then I've already indexed my book. And so I can just click here and it'll take me to my A's, B's, C's, and D's, E's through Z's. All right. Let's do a couple practice really quick here. So basic coding steps. What are you coding? You're going to be reviewing the documentation. That documentation can be in the format of an office note, a operative surgical report, a discharge summary from a hospital stay. Any of those sources, right, are going to be what you would be reviewing in order to extract what you need. And what you need is to find out what the patient's condition was, problem. That's going to be part of your ICD-10 search, and then how they manage this patient's problem, and that's going to be the search that you're going to find. You'll utilize your CPT book for. Figure out what the services are, and then you're going to start in your index to look up those services. Now, sometimes there's going to be a single code, or there may be a range of codes, multiple codes that you have to go investigate, right? Fortunately, these blue codes are all hyperlinked, so it'll take you right over to the section where those codes reside at to make it a little bit easier, okay? All right, let's do a couple quick practice scenarios, and we'll get you on your way. So I'm going to come over here to my all right, I'm already in my notes. So CPT practice scenario number 1, chest x-ray single view. So steps for coding. Ask yourself, what did the doctor do? Okay, they did an x-ray. What part of the body? The chest. How many views? 1 view. Single view equals 1 view. So your steps would be to go to your CPT index. If I wanted to go, my suggestion is always starting with your service, your procedure. So I would go to my X's for x-ray, and then I would start looking for my anatomic site of chest. You can see here we've been provided a range of codes. So we would have to go and see and determine which one fits best for us. And it would be based off of views. What did I not capture from my index? I captured x-ray, I captured chest. What I didn't capture is the quantity. And so here we are, 71045 represents a single view x-ray. And that's it. Now you've captured the appropriate code. All right, let's do one more. Next up, a CT of the abdomen and pelvis without contrast. So I would come over to my index, go over to my C's. I believe this is going to be computed tomography. So still going to have to do a little scrolling here. Colon. I went too far. All right, here we go. Computed tomography. Nope, I went too far. Oh, it tells me to go see CT scan. Okay. And so when I clicked on that little link, it took me right over to CT scan and then abdomen, pelvis. And you're like, now, which one should I choose? Well, in this scenario, when it tells you abdomen and pelvis, and you have two different choices, right? They each have their own code set. The next thing I'm going to do is say, is there anything in common in the code ranges? And what do I find there? I find that pelvis has 7-1 has two options, and the second option is 74177, and that's the same as in the abdomen. So since these two body areas have one single code in common, I'm going to start with 74177 and see where it takes me. So now over here in the tabular section, that's how easy it is. You just click on the blue code. It's going to take you right over to the tabular. Tabular is always where you finalize your code selection because that's where all the details are, right? Any additional instructions you might need. Awesome. So we can see here, oh, there's a great little grid too. And then CT, and always, by the way, you always have to read the parent code, okay? You don't want to just be like, yep, with contrast material, good to go. No, triple check the description of the parent or base procedure first before your final selection. So parent code, computed tomography, abdomen and pelvis. Stop. There's that semicolon. So anything after that is a variation of this. Doesn't change the base service. It's just a unique way that it was performed. This one was performed without contrast material. We have the detail of with contrast, so we need 74177. Same base procedure. Nothing's changed here, but it was with contrast material, so that changes our code. And then that's it. And then you have your final answer there. All right. I've got some extra additional videos. A lot of these videos are also included inside of your announcement. So I hope this was helpful. Take it easy on yourself. Keep it simple. Give yourself some grace, and you're going to do all right. If you have any additional questions, you know how to reach me. All right. Have a great day.